Hey everyone, a little bit about bioidentical hormones. So I often get asked, who is the best person to be on hormone replacement therapy? What else is there besides hormone replacement therapy? How long should you be on it? What are the options for other things that you can try besides hormones to help with symptoms? So first of all, it's important to understand that hormones are great. I've been a hormone user myself for a long time, but they're not for everybody. Obviously, there's a category of people who should not use hormones. Those would be people with hormone-related cancers, history of blood clots or clotting disorders, and other reasons, but those are the big ones. There are herbal supplements that can be very helpful for symptoms of menopause or perimenopause. And we use those often in functional medicine in lieu of bioidentical hormone replacement therapy. And mostly that's guided by patient choice. Sometimes it's guided by lab results, severity of symptoms, etc. If you should choose to go on bioidenticals, typically we recommend that we reassess your response to them and whether or not they are in a benefit versus risk on the benefit side every year, and then mutually make a decision collaboratively with the doctor. What is the best thing to do going forward? Typically, most people find that 5 years is kind of the time that we would recommend people use hormone replacement therapy, but it's a personal choice. Obviously, there's a lot of people who use them longer and others who find that they don't need them for 5 years. Who do we typically put on bioidentical hormone replacement therapy? It is our perimenopausal and menopausal population, women who are significantly symptomatic, who desire some of the proactive aspects of bioidenticals, such as bone strength, preservation of heart health and brain health that are starting to surface as reasons to use the current day modern versions of bioidenticals. But in general, I think it's important to know that there are choices, and just because you might have one of the risk factors, or you may have, a symptom that your OBGYN or your family practice or internal medicine doctor has said, I just don't think that's right for hormones, do know that there's a menu of options that are available. And obviously it's a personal choice. Work with a doctor, discover what's right for you, but do ask questions and seek out relief for your symptoms. It's worth it.